Okay, I just got this comment on one of my videos. Curious about your thoughts on VBAC, vaginal birth after cesarean, for patients with 1 C-section. My daughter successfully had 2 VBACs after her first crash C-section, but was met with a ton of resistance. Let me tell you what I think about TOLACs, T-O-L-A-C, and VBAC, vaginal birth after cesarean section. First, TOLAC, or trial of labor after cesarean, is a process that a person goes through in order to attempt to achieve a vaginal birth after cesarean section, or VBAC. And the evidence shows overwhelmingly that most patients who have had 1 prior low transverse uterine incision on their uterus are candidates for a TOLAC. And the low transverse incision means the incision is this way on the uterus, not up and down, not at an inverted T, not off to the side, not up at the fundus of the uterus, but on the lower uterine segment like this. This represents the incision on the uterus, not on the skin. Remember, the incision on the skin is not always the same as the incision on the uterus. People who are not good candidates for a trial of labor after cesarean or TOLAC are those that have had an inverted T incision, which means side to side down on the lower part of the uterus and then up and down, or a previous classical uterine incision, which means up and down on the uterus. Those who have a history of a prior uterine rupture, those who have a history of uterine surgery across the top part of their uterus, like sometimes occurs when patients have fibroids removed, and those patients who have a placenta previa. So where I work, we offer pretty much anyone who does not have a contraindication to a TOLAC, we offer them a TOLAC. But we have maternal-fetal medicine specialists in-house covering labor and delivery 24/7. We have OB anesthesia present 24/7. We have the expertise available in case of an emergency, like a uterine rupture, which can occur during the process of a TOLAC. All of us are trained to do those types of surgeries, and we can deliver the fetus in a very quick time period if we suspect uterine rupture. So the capabilities of the center where a patient would deliver also determines whether or not a TOLAC is available to patients. If the center does not have anesthesia in-house 24/7, an obstetrical care provider in-house 24/7, they probably will not and they should not offer TOLACs to any patients. The center itself, for whatever reason, may decide that they don't offer TOLACs to patients because they don't have the resources to manage those patients and deliver them expeditiously in the case of an obstetrical emergency like a uterine rupture. So if you're pregnant and you've had a prior cesarean delivery and you are interested in a TOLAC, that is something that your obstetrical care provider should know about as soon as possible, because if they can't offer a TOLAC to you, then they should find somebody who can. I've heard, though, that there are a lot of places that don't, and you can't find anyone to do it, and I hate hearing that, but with the way obstetrical care is provided in this country, it doesn't surprise me.